You see it all the time, the physical pain and the social embarrassment of varicose veins. Patients are discouraged to hear that a painful surgical procedure with a lengthy recovery is the only option. Now replace all that with this, the endovascular laser venous system, or Elvs, from AngioDynamics, and replace this, without surgery and without any real recovery time at all.
The laser is very safe. I've been using laser for over 10 years in my practice. The new precision laser by AngioDynamics for the use of ablating the saphenous vein, which is probably what you have in terms of your varicose veins, is really a safe, effective, proven method. And I really have been very happy with it. It's certainly better than the old procedure of ligation and stripping.
This procedure appeals to me primarily because it's minimally invasive. It's an opportunity to treat patients on an outpatient basis and allow them to return immediately to their regular lifestyle.
As you know, the laser has become one of medicine's simplest, safest, most effective tools. And as you're about to see, now AngioDynamics has adapted it to optimize your practice of vascular therapy in a procedure that's non-surgical, fast and simple, effective, reimbursable, in demand, and extremely patient-friendly. Now let's see exactly how it's performed. The Elvs procedure kit is intended for use in endovascular occlusion of the greater saphenous vein. The workup necessary for the procedure requires a patient history, physical examination, and a complete venous evaluation by ultrasound with Doppler. The equipment you will use is the AngioDynamics Precision 980 or 810 laser, along with the safety eyewear required in all laser procedures. A laser warning sign must be posted on the outside door of the procedure room. In addition, you'll need the AngioDynamics Elvs procedure kit, which includes these one-time use sterile disposables, a 600 micron laser fiber, a 5 French sheath dilator set, a .035-inch guide wire, a micro access set, which includes a 21-gauge 7-centimeter echogenic tip needle, a 5 French introducer dilator 10-centimeter length, and a .018 guide wire. The additional items you will need to perform the procedure are betadine solution for prepping the patient, surgical drapes, towels and 4x4s, steri strips, an indelible marking pen, ultrasound probe cover and gel, a basin for normal saline, and basin for tumescent anesthetic solution. Syringes of choice may include 30, 20, 10, and 5 cc's, 1% lidocaine for infiltration of puncture site. Hypodermic needles may include 18-gauge, 1.5-inch for drawing up medication, 25-gauge, 1.5-inch for tumescent anesthesia, and 30-gauge, 1.5-inch for local anesthesia at the entry site. For anesthesia, Dr. Kadnick's recommendation is 0.5% lidocaine with or without epinephrine at the access site, and 100 to 150 cc's of 0.25% lidocaine for tumescent anesthesia. If epinephrine is used, it is recommended that you buffer with sodium bicarbonate. Your own personal technique and experience may indicate other options, but this is the preferred method. With all these materials in place and following the instructions on your operator's manual, you may now set up the AngioDynamics Precision Laser. It's a simple process. You want to refer to the laser setup checklist, which you will find in your user manual. Start by plugging the power cord into the back of the laser. Plug the other end into the outlet. Attach the door interlock, and then the foot pedal. Press the main power switch on the back of the machine. Pull up the emergency switch on the top. Turn the key clockwise. Depress the foot pedal when indicated on the screen. Using sterile technique, open the kit package and remove the 600 micron laser fiber, being careful to keep it coiled to prevent breakage or mishandling. Now to the patient. First, examine the extremities. To begin the actual procedure, place the patient in reverse Trendelenburg position and distend the greater saphenous vein. Using ultrasound guidance, map the greater saphenous vein with the indelible pin from the saphenofemoral junction to the popliteal area. Mark measurements of the greater saphenous vein at the saphenofemoral junction. After prepping and draping the patient, administer local anesthesia to the entry site. Use ultrasound guidance and Seldinger technique to obtain micro-access entry into the greater saphenous vein. Remove the dilator and guide wire and insert a 0.035-inch guide wire into the vein through the access sheath. Remove the access sheath and insert the 5-French 45-centimeter sheath dilator set over the 0.035-inch guide wire. Flush the sheath with normal saline. Use ultrasound to check the position of the sheath, then advance the sheath to 1 to 2 centimeters below the saphenofemoral junction. Remove the dilator and guide wire. Attach a sterile, single-use disposable 600-micron laser fiber to the laser. Then tighten the laser fiber until the readout on the laser screen reads, "Laser standby." Now, insert the laser fiber into the sheath, positioned 1 to 2 centimeters below the saphenofemoral junction, so the distal tip of the sheath and the fiber are at the same point. Reconfirm with ultrasound that the sheath and the fiber tip are 1 to 2 centimeters below the saphenofemoral junction. Now pull the sheath back and lock it to the fiber sheath locking mechanism. Confirm the location of the fiber tip using ultrasound guidance and by direct visualization of the red aiming beam through the skin. Remember, the fiber tip should be 1 to 2 centimeters below the saphenofemoral junction. If you do not see the aiming beam, do not fire the laser. Check the position of the laser fiber tip. Next, administer perivenous local tumescent anesthesia. Dr. Kabnick recommends using 100 to 150 cc's of 0.25% lidocaine along the greater saphenous vein. Set the laser power to between 12 and 15 watts in continuous mode. At this point, everyone in the procedure room should put on their laser safety glasses. Activate the laser. Turn down the lights. Check the position of the fiber tip via the aiming beam and adjust the position as needed. Depress the foot pedal while continuously withdrawing a fiber tip at a rate of 10 to 12 centimeters per minute. Stop lasing 2 to 3 centimeters from your entry site prior to removing the fiber and sheath from the vessel. You may consider the procedure complete when the desired length of the greater saphenous vein is treated. At that point, you should perform a second ultrasound to confirm that the vein is closed and that there is no more blood flow. Post-procedure care is simple and easy. After the fiber and the sheath are withdrawn, hemostasis is achieved and steri-strips are applied to the entry site. Then apply a small, sterile 2x2 dressing with tape and a Class II compression stocking. The stocking must be worn for the first 24 hours and subsequently for 6 days. Have the patient take a 10-minute walk and then send the patient home with the instructions that normal activity may be resumed, but that vigorous activity and hot baths should be avoided for a week. Your patient should also know that tightness in the legs 3 to 5 days post-procedure is common and normal and may be treated with a non-steroidal anti-inflammatory agent. In terms of follow-up, periodic exams should be performed using Doppler and ultrasound to confirm occlusion of the vessel and no DVT. Repeat these exams at 72 hours and then again at 1 month, 6 months, and a year with recommended yearly follow-ups thereafter. After the 1-month follow-up, you may also perform additional venous treatment on any of the lower limb vessels that still remain enlarged.
Your patients will be very happy with the new Elvs procedure. They'll be able to return to their activities of daily living. They'll also be able to tell you that they experienced very little pain, if any, after the procedure.
I think the opportunities for growth in this particular area are incredible, and I think that it's going to be one of the most widely practiced techniques in the country.
That's it. In less than 2 hours, right in your office, you've helped your patients step into their future with a feeling of poise and confidence they thought they might never have. Thanks to your skill and Elvs, the endovascular laser venous system from AngioDynamics.